I wanted to give you a video version of what we covered Thursday in class about the antebrachium muscles. And so here we go. It's impressive to me to realize that on the dorsum at the wrist there are 12 tendons that either articulate into the carpal rows, or I should say interface with the carpal rows, or move on beyond the carpals into the metacarpals and the phalanges. We ought to know those 12, not as much emphasis on that yesterday on class as we want to do now. So appreciate the fact that there are two extensor carpi muscles. I should say three extensor carpi muscles. There are two radialis, one longus, one brevis. You know that I need to raise that up, don't I? And appreciate the fact that the reason the extensor carpi radialis longus gets the designation as the big brother is because it has its attachment higher up on the humerus. That's why it's the longest. And then certainly the extensor carpi ulnaris. And so those are wrist effectors, and when they work concentrically they obviously extend the wrist. And then we're dealing with the superficial muscles, and so the extensor digitorum, some anatomists call that the extensor digitorum communis, and it does not have a slip to the fifth digit or the first digit. And so you would imagine that there is an extensor digiti minimi, and also you're very familiar with the extensors and abductors of the thumb, and we've done that, covered that in a different video. Now, what is it that we're trying to accomplish? We're saying know the neighborhood of the muscles, know the region. These are the extensor group, these are the superficial. So dissect under the skin, and these are the muscles, the extensor carpis and the extensor digitorum communis, extensor digiti minimi. These are in the superficial layer, and I've said that this is really just for classification purposes level 1, posterior superficial. Then we move into the muscles deep to those, and consistent with what we've said before, a deeper muscle is the extensor indicis. Makes sense. You can see how it courses to the second digit and does what its name expresses. And then we were very interested yesterday in lab to have you palpate. I think I missed one group on this and hope to spend some time with them. But the muscle group that's known as the outcropping of three. And here are those three muscle bellies: the abductor pollicis longus, its name tells you what it does, and the extensor pollicis longus and brevis. What you need to commit to memory and also be able to palpate is that the extensor pollicis brevis and the abductor pollicis longus travel together in a more palmar direction. The extensor pollicis longus is on the opposite side of the anatomical snuff box. So the longus is on this side, it's the boundary of the anatomical snuff box, and the extensor pollicis brevis and abductor pollicis longus are the boundary for the other side of the anatomical snuff box. I've tried to do a little bit of a graphic on this. You see how these two muscles travel together, and then didn't find an adequate slide for this, so I put in a line, identified it as the extensor pollicis longus to make our point. The anatomic snuff box is right there. 2 tendons pass here, one extensor, one abductor, and the extensor pollicis brevis passes there. And then still deep, or being in deep, in the posterior aspect of the arm, the anconeus. We made a big deal about you pressing on your desk and palpating the anconeus. Obviously it's an extensor and synergistic with the triceps as a result. And then the supinator muscle is also deep. Its job does what it says. If you consider the ulna as being a bone that's going to be fixed and not do any rotating physiologically, the supinator wraps the radius around the ulna in supination. Now, it just so happens if you palpate your lateral epicondyle, we'll just go there, your lateral epicondyle, the widest part of you in the elbow region, there are 4 tendons that attach there. And so I ask the question, is it any wonder that lateral epicondylitis happens? If we overuse the muscles that attach on the lateral epicondyle, inflammation begins and it gets named by the location of that. And so people who do backhanded things and then get loaded like this end up having lateral epicondylitis. This could be called, whoever uses extensor muscles a whole bunch, extensors of the wrist, are prone to overuse syndromes in the lateral epicondyle. When a tennis player hits the ball, the force of the ball causes, in high speed, which means slow motion videography, there's this eccentric load, and this tends to be a weak link, and they get very, very painful, and sometimes when it's been in place for 6 months or more, anti-inflammatory medications, adjustment in training frequency, intensity, and duration, those things are adjusted. I think I said anti-inflammatory. It may require a debridement of the inflamed tissue. Tendinitis can lead to tendinosis, which is really degeneration of the tendon. So these 4 muscles are implicated in that because they all have their attachment on the lateral epicondyle. And so there are 3 groups of muscles that are kind of clustered, and one of those was the outcropping of 3. I want to remind you about the wad of 3. So if we pick up where you have a lot of muscle belly passing right there, you know that that's a quick communication that these are 2 of them are extensors of the wrist, and all of them are I'm not going to say that. The brachioradialis is an elbow flexor. So here you go, the wad of 3. So this is really a topographical kind of a deal where you've got a big mound of muscle and it gets a name, the wad of 3, brachioradialis, and the 2 extensor carpi radialis muscles, longus and brevis. Then we move to where we spend a lot of time in class, the most superficial anterior group of muscles include the brachioradialis and the flexor pronator group. And so there you go, there's the flexor pronator group, conjoined tendon on the medial epicondyle, and the thumb is the pronator teres, index finger, flexor carpi radialis, middle finger palmaris longus, and ring finger, the flexor carpi ulnaris. You're naming these by layer. So this is the superficial layer. The next deeper layer is the flexor digitorum superficialis. It travels by itself. There's 4 slips to the proximal phalanx of digits 2 through 5. The third layer includes the flexor digitorum profundus. Again, 4 slips, but you know the difference between the profundus and the superficialis is the profundus on the palmar surface or the volar surface of the skeleton, goes all the way to the distal phalanx. So those are motor effectors of flexion at the distal interphalangeal joint. And also the flexor pollicis longus is at that layer. The deepest layer, the pronator quadratus, so if the anterior forearm was dissected all the way to its greatest depth, we'd find the pronator quadratus, synergistic with the pronator teres. And then just want to make sure that you're way up to speed on the muscles that drive pronation and supination. I'm quite sure you have it. We've worked it together, just talked about these pronators, and then the supinator muscle and the really powerful supinator, the biceps brachii, that proximally has 2 heads, distally 1 tendon, and that tendon inserts on the bicipital tubercle. And so I hope that guides your study, gives you something to ruminate about. Hope this is worthwhile to you. Bless you. Bye.